So that kind of comes to how do we do this successfully, right? Well, let's start with the basics. We know that we are doing step one here, issuing this home exercise program, education. This is our prescription. We expect and encourage the compliance. Yeah, we do that. Okay. So we just need to formalize it for our patients, allow them not to um, have the initial fight back. This is what we do in our clinics, and this allows for more full reimbursement from your insurance. I don't have a problem saying those words. Um, Light goes on. Then the light goes on of from the PT's conversation of saying, look, we really know that these exercises help, and I have faith in my medicine that I'm providing as exercise. So if I can tell that you're doing it, we're going to be able to move on and change things. And if you tell me that it's kind of difficult or you help me track what's happening at home, we're going to be able to modify things quicker. Okay, great. It's going to allow you to ask questions outside of clinic appointment time too. Well, this is kind of already stuff that we've done. We're just more formalizing it, right? Um, some of the organic stuff happens here. Let's formalize how these points of contact happen with the patient. And now we can bill for these codes. Here's some other numbers with the 7577 breakdowns. I won't spend a whole lot of time because these slides are a little busy. But if we said, okay, if we build with the right workflow, we've got the patient buy-in, they're giving 16 points of data back, the system's sending it to us 30 days. In 2 months, 4 new patients just doing those steps, we end up with $480 additional reimbursement just for that supplying and encouraging. Um, in the light of what RTM is, both helping the compliance with that communication part of things, electronic and synchronous, we're going to have better compliance on that end. But we're also assisting the patient. They felt heard. And it may simply be, are things going okay? Yes. Did you like that new stretch? Yes. Is there anything else I can help you with? No. That goes like a long way with Grandma Sally, or recently retired teacher Jane, right? That's the cool thing. Now I'm going to back up just for a second and state, because what I just mentioned reminded me that yes, your Medicare, your Med Advantages, those that fall right underneath your CMS guidelines are reimbursing these codes. If you see other folks with other insurances, there's a steady trend in the commercial world where we're probably 60 to 70% of commercial insurances are reimbursing these codes. You do deal with more out of pocket within what the patient has to handle because they're CPT codes. They are billed as sometimes therapy untimed codes. So we got to figure out where those are coming in your bill schedule. That's part of our implementation training. However, they are not considered a clinic visit, so the patient's not responsible for a copay. Yes, coinsurance, because it is a CPT code at their regular rate of their insurance. Um, your Med Advantage plans that have a unit limit or a visit limit, it should not count against that visit limit either. So there's ways to handle things within your individual clinic needs. That's part of our training. So sorry, thanks for letting me regress. I forgot to mention that earlier. Um, this is for everybody, and it's going in that right direction. MVA insurances are paying well, and there's pilots in the workers' compensation world with RTM right now as well. So how do you get it done? Really, there's 3 ways that it's happening in clinics nationwide. Um, what I described to you, what I do is that clinic champion. So you take that extra little bit of attention and concern away from the in-clinic PT and you move it on to somebody else. It can be done in a couple hours. It can be if you allocate it within a week. So there's a lot of different ways. There's the mom that is returning from maternity leave that doesn't want to do full time. Well, she's got a couple hours. She can do it at home now. Lovely. It's great for both parties. Um, it can be the stud that's out there. He's not married yet, or she's not married yet and recently out of school. Maybe they've got an extra 3 hours that they're willing to put in for you at home. They do their 40 there, they do their 3 there. That's ways that this is getting set up for allocating time. Oftentimes it's a PTA that takes this role, and the clinic just says, you've got your 40 hours of clinic time. We're going to give you 3 hours spread along the week for your RTM duties. That's just part of their expected duties. And it ends up paying off. Um, that is one of the most successful models that we're seeing, where there's somebody always mindful about the RTM. Because the independent, if you move to a place where, all right, this is for the PT, it's going to be the PT that's having the communications with the patient. So it's going to be the PT that's following up with this patient. That makes the most sense in terms of value provided with these communications. I get it. It really does. Um, However, it is often lost just because it's a new habit, a new flow that's different enough in a busy clinic schedule that it gets lost in the shuffle. And so I have not seen this model be successful for clinics that are more than 2 to 3 therapists. If you're three or less, and that you just have your little hometown clinic, and that's you guys, your buds, heck yeah, knock this out, right? It's something totally doable in that case. So I'm just sharing what I've seen outside. Then the third way of doing it is kind of hiring an outsourcing your RTM component to a third party. There we go. I said it right that way. Um, so what that individual does, so the clinic PT still evaluates, still treats, still sets up the plan of care, still modifies the plan of care, does all that stuff. They send the home exercises, the education happens there, and the encouragement happens at the clinic level. However, the tracking and the communication is then done with this third party. So at Wibbi, what we say is, we've got you covered. Let's really kind of meet first, talk about your needs as a clinic owner, as your needs as an organization, and what part you want to invest in terms of workflow, and let's get you that right person in contact. So the outsourced component is basically a partnership within Wibbi that says, we'll do this for you. So we hand it over to there using the Wibbi platform and working together.